1. Which of the following is the primary goal of a Certified Vascular Access Nurse, CVAN, during patient education about vascular access care? A. To ensure the patient can repeat all instructions verbatim. B. To promote long-term adherence and self-care confidence. C. To decrease the nurse's workload through patient self-management. D. To meet hospital policy requirements only. 2. During competency evaluation of a vascular access procedure, which tool best ensures objective assessment? A. Peer review checklist. B. Subjective supervisor notes. C. Self-reflection journal. D. Informal observation only. 3. When developing a training program for new vascular access nurses, which adult learning principle is most critical? A. Passive lecture delivery. B. Rote memorization of protocols. C. Active engagement and real-world application. D. Repetition without discussion. 4. A nurse educator designs an orientation program emphasizing evidence-based catheter care. Which evaluation method best measures long-term learning retention? A. Post-training satisfaction survey. B. Skill demonstration 6 months later. C. Pre-training written quiz. D. Immediate verbal feedback. 5. Which federal regulation most directly impacts vascular access device documentation? Food Code. OSHA Bloodborne Pathogen Standard. C. HIPAA Privacy Rule. D. CMS Billing Compliance Act. 6. A vascular access nurse identifies a colleague performing suboptimal aseptic technique. What is the most professional mentoring approach? A. Report the colleague immediately to HR. B. Offer private supportive coaching with rationale. C. Criticize the action in front of peers. D. Avoid involvement to maintain rapport. 7. Which learning strategy best supports retention for adult vascular access learners? A. Repetition without feedback. B. Simulation-based practice with reflection. C. Assigned reading only. D. Written examination alone. 8. Which is the most appropriate measurable learning objective for vascular access training? Understand catheter maintenance principles. B. Know about infection prevention. C. Demonstrate proper flushing technique. D. Appreciate vascular access safety. 9. When evaluating the effectiveness of a vascular access education program, which data provides the best evidence? A. Employee attendance. B. Decrease in catheter-related infection rates. C. Participant enjoyment of the course. D. Number of PowerPoint slides used. 10. Which mentoring approach aligns best with adult learning theory? A. Directive, one-way instruction. B. Collaborative problem-solving and reflection. C. Immediate correction without discussion. D. Assigning repetitive tasks. 11. A new vascular access nurse shows inconsistent technique despite multiple teachings. The best educator response is to A. Terminate orientation early. B. Assess learning style and adapt teaching method. C. Repeat same instruction again. D. Delegate further teaching to another preceptor. 12. What is the best communication strategy when discussing complications with a patient? A. Use medical jargon to ensure accuracy. B. Provide clear, empathetic, and simple explanations. C. Give limited details to avoid anxiety. D. Let the physician handle all patient communication. 13. A vascular access educator wants to assess critical thinking. Which method is most suitable? A. Multiple choice quiz. B. Simulation scenario with debriefing. C. Lecture participation. D. Attendance tracking. 14. When documenting vascular access insertion, compliance with which standard ensures regulatory accuracy? A. OSHA workplace posting. B. The Joint Commission documentation standards. C. CDC patient safety guidelines only. D. A. Labeling policies. 15. The primary role of the cvan in reducing central line-associated bloodstream infections, CLABSI, is A. Monitoring supply inventory. B. Enforcing consistent aseptic practices. C. Recording patient satisfaction. D. Managing departmental budgets. 16. Into developing continuing education for vascular access nurses, what should drive curriculum updates? A. Budget and staffing. B. Emerging research and evidence-based guidelines. C. Staff requests alone. D. Instructor preference. 17. Which outcome indicates effective mentorship? A. The mentee performs independently with evidence-based rationale. The mentee memorizes all policies. C. The mentor avoids giving feedback. D. The mentee depends on the mentor for decisions. 18. When evaluating learners' competency, formative assessment is best described as A. Final certification exam. B. Ongoing feedback throughout training. C. Annual evaluation summary. D. Post-employment audit. 19. The nurse educator includes peer feedback during training. This primarily enhances A. Competition among learners. B. Collaborative learning and accountability. C. Course evaluation ratings. Testing speed. 20. Which is the best example of regulatory compliance documentation? Patient stable. B. Catheter site prepped with 2% chlorhexidine for 30 seconds before insertion. C. All procedures performed correctly. D. No complications observed. 21. Which of the following actions most reflects evidence-based vascular access practice? A. Using alcohol swabs for all dressings. B. Selecting catheter size based on vessel diameter and therapy type. C. Preferring central lines over peripheral lines for all cases. D. Using tape instead of securement devices. 22. In curriculum development, which step ensures learning activities meet goals? A. Writing objectives before assessment methods. B. Designing assessments first, then outcomes. C. Setting objectives after teaching. D. Ignoring learner input. 23. When teaching adult nurses about ultrasound-guided IV insertion, the educator should A. Deliver a lecture with diagrams only. B. Combine demonstration, hands-on practice, and debrief. C. Focus only on theoretical principles. D. Provide videos without discussion. 24. Which best promotes infection prevention in vascular access? A. Hand hygiene before and after every access. B. Only cleaning after visible contamination. C. Flushing with saline every 24 hours, regardless of policy. D. Reusing sterile gloves if uncontaminated. 25. During evaluation, a nurse educator notices repeated errors in documentation. The best educational action is to A. Discipline the learner. B. Provide targeted remediation with examples. C. Reassign the learner. D. Reduce evaluation frequency. 26. A vascular access mentor uses questioning to guide reflection. This is known as A. Directive teaching. B. Socratic mentoring. C. Passive observation. D. Performance correction. 27. Which element is critical when developing a vascular access competency checklist? A. Task sequence and measurable performance criteria. B. Open-ended reflection only. C. General knowledge statements. D. Learner preferences. 28. Which best demonstrates professional accountability in vascular access nursing? A. Documenting all care immediately and accurately. B. Delegating documentation to assistants. C. Reporting only major complications. D. Avoiding policy review. 29. When reviewing a new vascular access guideline, a nurse should first A. Check it against evidence-based literature. B. Ignore it until mandatory. C. Rely solely on manufacturer instruction. D. Ask colleagues for opinions. 30. A nurse educator plans to evaluate program effectiveness annually. What type of evaluation is this? Process evaluation. B. Summative evaluation. C. Formative evaluation. Diagnostic evaluation. 31. When instructing about central line maintenance, which adult learning method ensures engagement? A. Group problem solving using case studies. B. Reading policy manuals silently. C. Watching a video only. Taking written quizzes. 32. Which best describes a professional mentoring relationship? A. A supportive, goal-oriented partnership focused on growth. B. A friendship without structure. C. A one-time evaluation. D. A disciplinary oversight role. 33. Which agency provides guidelines for vascular access infection prevention? A. United States Department of Agriculture, USDA. B. Centers for Disease Control and Prevention, CDC. C. Federal Aviation Administration, FAA. D. Environmental Protection Agency, EPA. 34. What is the best indicator of successful communication between the vascular access nurse and patient? A. Patient can explain care steps in their own words. B. Nurse finishes education quickly. C. Patient nods in agreement. D. No questions are asked. 35. In performance evaluation, a nurse educator identifies learning gaps. The next step should be A. Provide individualized learning plans. B. Report poor performance immediately. C. End the training session. D. Reduce supervision. 36. A new vascular access guideline mandates transparent dressing changes every 7 days. To ensure compliance, educators should A. Implement training and audit adherence. B. Post notices only. C. Leave responsibility to unit managers. D. Assume prior knowledge. 37. When mentoring peers, which behavior fosters a learning culture? A. Sharing knowledge openly and encouraging questions. B. Withholding tips to maintain authority. C. Avoiding discussions to save time. D. Correcting mistakes publicly.